Pidgeon. I'm from Philadelphia, Pennsylvania. I've been pastoring a church since 1981. And when my wife found out she needed knees, the insurance company that we had was not going to cover it. 3 doctors said they would not even as much as put in an apply and request because they knew it would be turned down. I didn't know really what way to turn or what to do. And I said to my wife Kathy, well, let me just pray and see what we'd come up with. One day I was on the computer and I was typing in different search engines, and I thought, let me type in search engine out of country medical to see exactly what it cost. And I typed in, found Costa Rica here. It's very close to home. I started reading about it. I watched the video of Dr. Wedding and his experience.
My name is Kathy Michelle Pidgeon. I'm from Philadelphia, Pennsylvania. I work for Bucks County Courthouse in Doylestown, PA. I work for the judges. I file papers. I lift boxes, which is 50 pounds. I worked 33 years in the county.
When 3 doctors in the United States stated emphatically she needs a knee, but she's too young, they will not improve it. There was the first doctor that took care of her for over 7 years. Cortisone injections, Synvisc, every kind of treatment possible, the physical therapy, to no avail. I'll credit that doctor with being honest and saying, look, we can't continue cortisone because of your heart. It will affect your heart. You can go to another opinion, but I don't think they'll give you knees either because of your age.
Yeah. Actually, I was really satisfied. I was very, very pleased. Very pleased how everything went in order. Very, very happy. Like my husband said, I didn't have to worry about where to go. Everything's all taken care of. I was very, very happy about it. My husband looked him up on a computer. I had sat down on the computer, in front of the computer, and listened. All the experience that he had, college, background, and stuff, and I listened. And after the video was over on the computer, I kept thinking to myself, I kind of like this guy. I'm going to go with him. I trust him because he had the good background.
One thing that impressed me very much about medical care organized here in Costa Rica by International Medical Association is that, to my surprise, her physical therapist was one-on-one. It isn't somebody that comes out to your house for 15, 20, or 30 minutes, but he took personal interest in her as his client. We didn't get any quotes back at home because realistically, we'd lose our house, our car, everything we own to get it done at home. That's the picture. We're not upper middle class, we're middle class. We were saving for our pension. We realized that the investment in the knees is much better than going away after you're retired and be in pain. And then they would do the surgery, and it could take 6 to 8 weeks longer to recuperate. And the risk of it not taking because your bones are old. So you got to sit down and think for a minute what's more important.
Actually, I could do more work than I ever did before, which I never did before. I couldn't do my housework. I couldn't do the yard work. I couldn't go up and down the steps without being in pain. There's a lot of things I couldn't do. Now, since I got it done, I should be able to do all that. And I'm looking forward to doing all that again, without being in pain.